Welcome everyone, welcome to my channel Medical Lectures and Mnemonics. Today I'm going to talk about a very important topic which is called hematometra. In the previous video I have already talked about the hematocolpos, which was the accumulation of blood in the vagina. So in this video I'm going to talk about the hematometra. And the hematometra is the accumulation of blood within the uterus. It is the retention of blood within the uterus. So this retention of blood in the uterus is called a hematometra. Now the causes, there are mainly two type of causes. One is the congenital causes, the other is acquired causes. The congenital causes include the impurpurated hymen. When the hymen is impurpurated from the birth, it will unable to let the flow of blood from the uterus into the exterior. The other is the transvaginal septum, which is a septum which goes horizontally in the vagina, which also to block the blood flow. The other is atresia of uterus, cervix, and the vagina. When the uterus, cervix, and vagina does not canalize, it will not let the blood to flow. So the other is vaginal hypoplasia. So these conditions are block the blood to not flow from the endometrium into the exterior. So the second condition is the acquired causes. The acquired causes include the cervical stenosis, the intrauterine adhesions, and the endometrial and cervical cancer. These three are the acquired causes, and they also block the flow of blood from the uterus into the exterior. So how the patient of the endometrium will present to the doctor? Mainly the patient will present with cyclic pain in pelvis, and some patient may present with urinary frequency and retention. In the premenopausal women experience abnormal vaginal bleeding. These may dysmenorrhea, which is the painful menstruation, and amenorrhea, which is the lack of menstruation. So the patient may present with these symptoms. The other is postmenopausal women, mostly asymptomatic, and the patient of hematometra may present with low BP, and when the uterus palpated, the uterus firm, and it will be enlarged. So now how to diagnose the patient? To diagnose the patient, the history of the patient required. The history of amenorrhea and the cyclic pain. These two things actually gives clue to the pathology of the hematometra. The main diagnosis can be done by ultrasound, which will reveal the retention of blood in the uterus and the uterus enlargement. So, per congenital disorder, mainly laparoscopy is done to diagnose the hematometra. Now, how to manage the hematometra? The hematometra can be managed by blood drainage via cervical dilation. The blood can be drained from the uterus through the cervical dilation. The other is biopsy to rule out the nucleus. As I have already talked about that endometrial cancer is also led to endometra. Here you can see endometrial and cervical cancer. So biopsy is required to rule out neoplasia. So this was all about the hematometra. For more videos, subscribe, like, and share. So thanks for watching the video.